Hi, my name is Sharon Rose Nisley, and I am a patient advocate for several rare disease conditions, but the main one that I work on bringing forth change for is Klippel-Feil Syndrome. And I originally started connecting with groups on MD Junction online, and then went to form and co-founder the Klippel-Feil Syndrome Alliance. And I've been working there with you, our community, for the past 2.5 years. Recently, I made a change and started a new community. I'm no longer affiliated with the Klippel-Feil Syndrome Alliance, but our new community is called, excuse me, sorry, it's part of having this condition, the Klippel-Feil Syndrome Freedom page, and I will post the link under the comments of this video. At Klippel-Feil Syndrome Freedom, we are starting a new group and subsequent private groups for each age and for our parents and caregivers, and we are building, so please bear with us as we do this. One of the things that had come up recently is a comment that I am doing this rather selfishly, and I just want to clarify with you that my heart is for you, and I don't always have all the answers, but within our community we are a very wise and empowered group, and often if I don't know the answer, and I often don't, we don't have the resources that we need yet, and but we always have someone who has some information, some experience, some knowledge that can help you, and part of our network here is to provide that for you. I'm just kind of the voice. I'm kind of, it's something I'm passionate about, and I work towards every day for a little while. I try to. I am in chronic pain, and I do suffer from this, and so I do need breaks, as anyone would, but it is something that I am committed to, and I'm committed to trying to help you and help you to empower yourself with information about Klippel-Feil syndrome. And it's not about me, it's about you. It's about us as a community. It's about kids and infants that are born now that need a lifetime of care. It's about the fact that when you turn 18, you get in that age range where you're no longer being cared for by pediatrics hospitals that embrace Klippel-Feil syndrome patients. And you then are looking for hospitals that are few and far between that do have an understanding that Klippel-Feil syndrome is not just about fused bones in the neck. Klippel-Feil syndrome is often a very painful, complex condition that needs multidisciplinary care from various specialists, and specialists who understand that just because we don't have a lot of research right now and we don't have a lot of documentation, that doesn't dismiss our symptoms. And that is a main goal right now that is on my mind, is to give the hospitals and medical community information, whatever medical or research documents that we can put together into a packet with a letter explaining the truth about Klippel-Feil syndrome and what we go through, and to ask them to embrace our patients at any age, whether it's pediatric hospitals or hospitals and healthcare facilities for adults. This is just one of the main things that is key for us. The other thing is that, doctors tell patients that Klippel-Feil syndrome is common. And to be honest, it's the same thing. We don't have the current numbers. Yes, there are probably people that have fused bones in the neck, which is a KF anomaly, but they may not have the syndrome, meaning they may not have other organs or issues in their body that are affected by the fused bones in their neck. But for most of us who are going to the doctor because of pain and symptoms and issues in our body and multiple conditions that we don't know are they associated or not, it's rather cruel to tell a patient who is suffering basically that the thing called Klippel-Feil syndrome is not the culprit when you don't have the information to prove that either. So that is something that's very important for our community, for our care. Sorry, I'm looking away here. I think that really covers it, but please visit us at Klippel-Feil Syndrome Freedom on Facebook. I will post the link. And be aware that we have a full notes section. It is always changing and growing. We are always putting new information into it. And you do have to sit down and really look through it and read. You know, when I was diagnosed 5 years ago, there was no central location with information and advocacy. I spent hours, as many of us do, just searching online. But now we've tried to, as a community, compile the information, and it will get more organized. But it is just so valuable for you to sit down and look through the notes section and read it and see what you need. You can print things out and bring them to your doctor. We have the medical documents that are available. And we're going to be working on how to have some medical documents put together that talk about the pain, that talk about the symptoms, that talk about the conditions that may be related, so that we have something that we can bring in that is validated by the medical community. You know, I understand that right now there's nothing for a doctor to really turn to quickly. And they often do dismiss a Facebook page, and I understand why. I understand that. But we do have medical documents within the notes section, and we have, you know, our community speaks for ourselves. I just hear day after day of people suffering in pain, people searching for doctors, people being told the Klippel-Feil syndrome is just fused bones and that it's very common. But the truth is, most doctors never see a Klippel-Feil syndrome patient, and when they do, due to their own, you know, job constraints, they don't have the time to really look into it. And so it's a problem on both ends, but we want to encourage the medical community to work with us, and we want to connect with hospitals and provide information, and we want to improve the lives of those who are suffering from Klippel-Feil syndrome. And that includes families and caregivers and everyone, friends that are so supportive. But I just wanted you to know that the goals stand, and I will not back down, and I know you will not back down, and together we will bring forth improvement for Klippel-Feil syndrome. And just remember that the skeleton key is our symbol of hope for a rare skeletal disease. So please find a skeleton key that speaks to you, that is unique as you and your family are, and wear it. Collect them. Tell people about Klippel-Feil syndrome. Use it as a conversation piece. Thank you for listening. Bye.